trying to decide your programs.
And last question, a lot of what we deal with in Medicaid, it clearly hinges, you can't just reform. When you reform Medicaid, it hinges on Medicare, it hinges on private pay, it hinges on everything. So how can you, are you able to really bring an understanding to that of all of those changes? Because, it's like a balloon. You push one place, something else is going to pop out. But, if you are heavy-handed in one, it's going to affect the others, particularly in different populations around the state of Arkansas, because we're very diverse in the state of Arkansas. So it's not a one-size-fits-all approach. So I'm interested to see how you would answer that question as far as your approach going forward and looking at not only our diverse populations, but also the diversity within the industry itself when you're dealing with vast changes in Medicare and private insurance.
Yeah, and there are significant impacts on employers.
I would say Salvage Mercy was engaged by a New England state that is known as the insurance state to bring their stakeholders all to the table. And that same state is no longer a managed care state, so I thought that would be a very interesting situation to sit in the room with Medicaid and those same insurers that are no longer in the program and have a conversation about managing the care for the population. And so I think that would be one of the recommendations, to have all of your stakeholders involved in that conversation so that when you push this balloon, everyone at the table knows the impact of any push on their service and their bottom line, and then designing something that everyone can live with and tolerate. I think the other thing that is key to any Medicaid reform or redesign is to consider your consumers. You have a very large rural population. You have access to providers that's challenging for that rural population. And then you have this behavioral health component that is just out there. And so I think bringing all of those folks to the table to really sit down and discuss the outcomes of the findings and figure out how we move forward together would be my first suggestion.
And can I ask one last question, Mr. Mosley, North Carolina? Were you there with the AHEC program in North Carolina is really addresses a lot of rural issues.
The Area Health Education program. Yeah, in fact, Dr. Nathan started that program years ago, and I was a city manager in rural Arizona. That AHEC program saved rural Arizona in terms of the ability to find healthcare professionals and provide ongoing training and those types of things. And they are a real answer to health disparities in rural areas.
Yeah, I know in North Carolina they also have a really great system.
Right. Are you talking about AHEC or Community Care North Carolina, which is their
the
primary?
Area Health Education Center.
Okay, right.
Okay, thank you.
That's the first time anybody's ever asked me about the AHEC program. Everybody always wants to know about CCNC. Are you a nurse?
No, Mary's her physician.
Oh, okay.
But we did look at that program in Arkansas. I think based theirs on North Carolina, but there were some really innovative things that were happening 20 years ago in that system that we still haven't reached in Arkansas. So I was just
Well,
curious.
the collaboration between the local medical societies and the AHEC program, and then the community colleges all coming together has been a real catalyst for success in that state.
Thank you.
Okay, and the final person on the list today, as he was for the first morning session, is Representative Hammer.
Thank you, Mr. Chair. Dr. Bledsoe, Surgeon General Bledsoe, asked you a question a while ago, and I didn't hear a defined answer, and it was regarding getting information out of state agencies, and does your bid include what is going to be necessary or do that data mining to get down? Is that in your price?
Absolutely.
Okay. And then secondly, you answered very confidently that you felt we would get a block grant, and in my opinion, the reputation of your company and this committee in the state is essential that we get that block grant, in order to justify getting this contract. So why are you so confident that you think we're going to get that block grant?
No, I didn't say I thought you would get one. I said that I think it was of merit, and I agree that it was of merit. Under the current administration, it's not going to happen. White House and you control the House and the Senate. What Cassidy and others have proposed is there are two things. One is the block grant is in total dollars, and one is a risk-adjusted PMPM, which is the Cassidy plan, which Hatch and Cornyn and others kind of took as their own. That has a lot more opportunity. Is a national PM per member per month people on Medicaid, and giving that to the states and let the states manage it. The other opportunity is just to take a lump sum of money and give it to the states. I see the PMPM perhaps having more chance, but I don't think either have a chance until sometime after 2016.
Okay, and then final question is, there's been several times that a question, the question of understanding the request for proposal, and I heard you say you've asked a lot of questions and everything. At this time in which you're making this presentation, are you fully satisfied that you've gotten all the answers to all your questions, that you would be able to stand behind your bid as it's written, or are there any other questions that you have that you haven't had answered about the scope of the request for proposal?
I'd just like to know how quickly we can start.
Okay. All right, thank you, Mr. Chair.
Okay, we've got another one that wants to ask a question. Senator Chesterfield, you're recognized.
Thank you, Mr. Chair. Let me preface more of a statement. I was impressed by the diversity of the presenters. Not quite as impressed by Mr. State's rights over here. That's all I have to say about it.
I am sure glad you stuck around this afternoon.
Mr. Senator, I did say that he had addressed me as an individual citizen, not as a member.
And I stand hold against you.
No, please.
All right, members, that's all we have on the list for today. Ladies and gentlemen, I would like to thank you all for your presentation and your patience with us and enduring the hours of questioning. Great job. Again, thanks for coming from such different places to come to Arkansas. Members, the materials will stay here. We'll be back again for repeat tomorrow. So thank you all for your diligence. We've got tremendous participation. I know we've got almost 80 or 90% of the members here, and I appreciate that. And we will press on forward tomorrow. Without objection, we are 9 a.m. in the morning. We are adjourned so far.
Hello. Hi. Oh, sure did. Yeah. I think I've recognized you this morning. It's nice to see you. Well, thanks very much. Hard going first. Hi, Diane. Are you Linda? I am Linda. I'm Ivy Bennett. Well, hi. How are you? It's nice to see you. I haven't seen you in years. Yeah. A long time. I'm Ivy. I used to work in the state of Texas. But I recognized you. Oh, you did? Yeah, I was looking at you. My God, she looks familiar. Isn't it crazy? I know you're talking about this group. I'm like, oh, I know that. Oh, you're in foster care. How are you? What are you doing here now? Well, I work for Maximus now. I took some time to, and I worked for Deloitte doing system integration and changes. And then I realized I was only home 6 days a month. So I was like, I have no personal life. No, no, really. Friends anymore because they gave up on me. So I'd be like, I call people and everyone's busy and I get sent prep. Yeah. That's it. I gotta come up. I hear you. That's such a